Good afternoon and welcome to the Mental Health Commission of Canada's webinar on the new National Standard for Psychological Health and Safety in the Workplace. My name is Najma Bond. I'm the Director of Communications at the Commission and very pleased to be your host for today's webinar. This session will last 1 hour and is being recorded. We're very excited to present this new national standard and explain how organizations like yours can use it to improve psychological health and safety in your workplace. And I must mention that over 900 people have registered to join us today from around the world, so we're very happy to welcome you all. Today, I'll be interviewing two important guests, Louise Bradley, who is the President and CEO of the Mental Health Commission of Canada, and Chuck Bruce, CEO of the Nova Scotia Public Service Long-Term Disability Plan Trust Fund. Chuck was the chair of the MHCC's Workforce Advisory Committee and instrumental in the development of the standard as a key member of the technical committee that developed it. Welcome to both of you, Louise and Charles. After the two interviews, those of you listening will have the opportunity to ask questions by using the chat function at the bottom right-hand of the screen. We'll begin with Louise now. For those of you who are not familiar with the work of the Mental Health Commission of Canada, Louise, could you briefly explain to them how the Commission was formed and talk a little bit about some of its key initiatives?
Certainly, Najma, thank you. In 2003, after a very strong lobbying effort by national mental health groups across Canada, then Senator Michael Kirby began Canada's first national study on mental health and mental illness and addictions. After he went across the country speaking to thousands of people, the committee saw a great need for a better health system, and from that they published Out of the Shadows at Last, which is a report recommending the creation of a national organization at arm's length from government. From that, in 2007, the Mental Health Commission of Canada was formed, and the Commission has a 10-year mandate. We are a catalyst for system and social change that leads to improved mental health for Canadians, and we collaborate regularly with people and organizations that have a role in transforming the system. We have several main projects. I'll mention some of the more notable ones here. The Mental Health Strategy for Canada was released last May, providing a blueprint for system change in Canada. At Home Chez Soi is our project that is researching how best to help homeless people living with mental health issues, the largest of its kind in the world. Opening Minds is an initiative that is evaluating and replicating the best anti-stigma programs across the country. Mental Health First Aid Canada teaches people how to recognize the signs and symptoms of mental health problems and how to provide initial help. And lastly, our Knowledge Exchange Center, which is focused on sharing knowledge from the field with a variety of stakeholders and putting that knowledge to use. On top of that, over the past 5 years, we've also had a wide range of research projects, from peer support to how police interact with people who live with mental illness. And these projects, some of which are still underway, were undertaken to inform and support our strategy, and other initiatives.
Thank you, Louise. That gives people a great idea of what the Commission is up to. Now, how does this new standard on psychological health and safety in the workplace tie into the Commission's work?
Well, the Commission is dedicated to improving mental health in the workplace, and during the research and consultations for the mental health strategy, it became clear very quickly that improving mental health in the workplace was a priority. So the strategy's priorities related to workplace include creating mentally healthy workplaces, improving access to income support programs, removing barriers to pursuing education and obtaining or returning to work, upholding the rights of people living with mental health problems and illnesses. So these are the primary pieces within the strategy.
Louise, how many adults actually experience mental health problems in this country, in Canada?
Well, the statistic in Canada is similar to elsewhere in the world, which is 1 in 5 adult Canadians will experience a mental health problem in any given year, not over a lifetime. I think one of the surprising facts we're coming to recognize now, however, is that by the age of 40, about 50% of the population will have or have had a mental illness. So adults in their prime working years are among the hardest hit by mental health problems and illnesses, and we spend more waking hours in the workplace than anywhere else. So this reality is something that employers need to be very much aware of. The standard is designed to help businesses and organizations make their workplaces psychologically safe for everyone. And if the workplace is psychologically unsafe, over time it can contribute to mental injury such as depression.
So, Louise, this is a key point. What are some of the factors that contribute to a psychologically unsafe workplace?
Well, in 2010, the Commission published a working paper called The Road to Psychological Safety, and it outlines the legal, scientific, and social foundations for the new standard and uncovered some of these factors. We know that risks to mental health are more likely to arise and contribute to a psychologically unsafe workplace based on several factors. Some of these are job demands and requirement of effort, so that job demands may consistently or chronically exceed worker skill levels, or that they are exploited beyond what could be considered reasonable. Problems can also arise when work is distributed unequally. Another factor is job control and influence, discretion over the means, manner, and methods of their work, including the freedom to express views or feelings, is extremely important. Reward is another factor in the health of a workplace, so things like praise, recognition, and acknowledgement of work well done is extremely important. And we have to look at fairness. There may be consistent failure or refusal to recognize and accommodate legitimate needs, rights, and claims of workers. Perceptions of failure can also arise from feelings that decisions were made without attention to due process. And another significant factor is support. That means support with regard to advice, discretion, planning, and provision of technical and practical resources may be withheld from workers. All of these factors contribute to mental injury, and so it's important for us to take a really good look at our workplaces to see how these sorts of things can be improved upon.
And Louise, you've touched upon this, of course, but what can be the extent of the effect of these factors when it comes to employee health?
Well, in the report I just mentioned called The Road to Psychological Safety, it was revealed that a psychologically unsafe workplace takes its toll not only on mental health but also on physical health. These factors can lead to a higher risk of mental health problems and conflicts, and also to back pain, substance abuse, infections, and even certain types of cancer.
So clearly, overall, in the end, this could potentially have a great impact on the organization as a whole. Can you talk about that aspect?
Yes, and I think it's illustrated well in the diagram that you now see on the screen. And this diagram was included in the report I was talking about. In the center, you can see that employees may be putting in a high level of effort but receiving a low level of reward. On top of that, there are high demands on them in an environment over which they have little control. This can be magnified by a perception of unfairness, result in strain, and both mentally and physically. So this not only affects employees, but also has an adverse effect on business itself. So it can result in low commitment and motivation, but also low customer satisfaction, low creativity, retention of staff, and an inability of the business to compete. So these are obviously very serious consequences for any type of business.
Absolutely. And if businesses and other types of organizations are struggling because of these factors, Louise, how does this affect the economy?
Well, that's a good question because it's not only human suffering we're talking about here, but economic losses. So, in fact, the annual loss to the Canadian economy due to mental illness and problems is over $50 billion a year. So, needless to say, very significant. Mental health problems and illnesses are the number one cause of disability in Canada, estimated to account for nearly 30% of disability claims and 70% of the total costs. We also know that the longer somebody is away from work due to illness, the less chance there is of a successful return to the workplace. If unaddressed, the impact of mental health problems on lost productivity will cost Canadian businesses $198 billion over the next 30 years.
Okay, that's staggering. Thank you very much, Louise, for this great introduction to the situation. And we'll be back to you a bit later, probably during the question and answer period. Our second speaker today is Chuck Bruce. Once again, he is the CEO of the Nova Scotia Public Service Long-Term Disability Plan. Chuck is a member of the Standard Technical Committee and past chair of the Mental Health Commission's Workforce Advisory Committee. Welcome, Chuck.
Thank you very much. It's great to be here today, and as a follow-up to January 16th, our most recent event.
Chuck, Louise talked about why mental health in the workplace is such an important issue for Canadians, and I'd like to focus a little bit more around some of the detail about how the standard was actually developed. What is the history?
Sure. So the history, it all began more than 10 years ago with the Global Business and Economic Roundtable on Addiction and Mental Health with co-founders Bill Wilkerson and Michael Wilson in 1998. This was then followed up in 2008-2010 timeframe by the work of Dr. Martin Shane, commissioned by the Mental Health Commission through its Workforce Advisory Committee, and specifically in two reports, Stress at Work, Mental Injury and the Law in Canada, and Tracking the Perfect Legal Storm. This literature highlighted 7 areas of law trending toward holding employers increasingly responsible for providing a psychologically safe workplace. Then in 2009-2010, 2 separate groups came together, and in 2010 a group came together to address the need for immediate information about providing a psychologically safe workplace. This included executives, labor, health and safety, government representatives, experts in law, and also an important note is it included individuals that shared their personal stories on the impact that the workplace can have. Then bringing into the spring of 2011, a call for members and nominations was initiated by the Canadian Standards Association and BNQ in Quebec as 2 standard-setting organizations in Canada, and a technical committee was established in the spring of 2011 to work on the creation of the standard. And as I believe most people should be aware on the call today, the standard was launched on a very proud moment in Toronto on January 16th of this year.
Absolutely, Chuck. And for those who weren't there, if they want to get a taste of what that was like, they can visit the Mental Health Commission of Canada website, and there we have video clips and an overview of the actual launch scenario. Chuck, can you tell us about the range of people who were part of the technical committee?
Certainly. The committee members were all volunteers and represented the perspectives of 5 different interest categories. And that was important for 2 reasons. One, to have a balanced representation of individuals across the country, but also interest from different categories. Those interests, as you see on the screen, organizational interest essentially included large business, Employee interest included labor. Labor was represented by individuals from the CAW, the Public Service Alliance of Canada, and the Canadian Association of University Teachers. Service provider interest, which included the consulting community, occupational health physicians, the Canadian Mental Health Association, and others. Also general interest, which included small business, clinical, and Dr. Martin Shane that I referred to a moment ago. And regulatory, insurance, and policy interest included myself, WorkSafe organization, individuals from the federal government, and Great West Life. And there were a number of other associate members that represented various professional and association groups.
Now, Chuck, also in terms of who developed this standard, there were a number of individuals and some forward-thinking organizations. Can you talk a little bit about that?
Certainly. So, who developed the standard? Well, a number of very committed individuals, forward-thinking organizations, as you mentioned. The Mental Health Commission of Canada championed the development of the standard and collaborated with CSA and BNQ as the two standard-setting organizations in Canada. Another important point to note is funding, and funding came from Bell Canada, Great West Life's Centre for Mental Health in the Workplace, and the federal government of Canada.
Absolutely, a collaborative effort. Chuck, is this standard, and this is a question that we have received already a number of times, is this standard something that will be mandatory for businesses and organizations in Canada?
No, that's a great question, and not at all. In fact, the standard is something that I want to emphasize as completely voluntary. The standard is completely voluntary. It is not a legal requirement, but simply a tool or framework to assist businesses and organizations improve the psychological health of their workplace. It is also, to emphasize one of the guiding principles, is that psychological health and safety is a shared responsibility and has been developed based on active participation. So the responsibility of the standard doesn't lie with employers alone. Everyone has a part to play.
Chuck, who now can actually use the standard? Would you say it's mainly for larger organizations that have human resources departments, or is it more widely applicable?
It is certainly for large organizations. It is certainly for medium and small size organizations, and it is certainly for both the public and private sector. So in response to your question, not at all is it only applicable to large business. It's applicable to any type of organization, no matter its size, industry, or geographic location. And for our guests joining us outside of Canada today, I would also challenge them to consider the standard. It's intended to provide guidance for change. Changing how businesses and organizations approach mental health and mental illness in the workplace. So any organization can apply various parts of the standard as needed. That may seem confusing at this point in my remarks, but I will clarify that a little further.
Okay. Okay, great. Thank you, Chuck. I know that, from what you're saying, it sounds like an organization doesn't necessarily have to start at the beginning of the standard. They can look at some key areas in their workplace, assess the level of risk, that kind of thing. So they can start almost anywhere within it?
Well, anywhere within it. Let me bring you to 4 specific points. So yes, some will want to focus starting on policy statements, if that is right for that organization. Others may focus on processes related to identification of gap analysis and data collection and so forth. There is no one-size-fits-all model. I think what's most important to remember is, number one, gaining buy-in and commitment from senior leaders and engaging the workplace. I think champions is a term most people are familiar with to move this agenda forward. Number two, using a documented process to assess the organization. And what I mean by that is establishing baseline data, understanding where you are today to determine the baseline of health within the organization. Number three, taking action on any areas that have been identified as concern as a result of the documented process and or survey instruments that I noted in my point two. And four, measuring your action or effectiveness and audit your action against the plan you started with. Based on your organization, anyone's organization that is representative on the call today, in my view, if you start with number one, being the commitment from senior leaders, or you start with number two, being the data collection and analysis, really depends on your organization.
All right, Chuck, now you are going to next get into the psychosocial factors, and the standard addresses 13 of those. What do we mean when we say psychosocial factors?
So the standard addresses 13 psychosocial factors. What we mean when we say psychosocial factors, we're referring to areas that influence psychological health, individuals' psychological responses to their work and their workplace.
And of course, it's important to note that the standard is not necessarily just about how to improve workplaces for people who already have a mental illness or a mental health problem.
That's right. Prevention and promotion are at the forefront of the development of the standard. But any of these factors can potentially cause psychological health concerns. They include the way work is done, deadlines, how much control people have over their work, and so on. And the workplace context itself, which would include relationships between staff and management, between your peers, and also interactions with clients and customers for those in business of that nature. These factors can be positive and negative and can increase the psychosocial risk for mental health problems and illness. So not only this, but if workplaces ignore these factors, it's more likely that employees with existing mental health conditions will face further challenges with their own health.
And so clearly it's pretty important that organizations pay great attention to these 13 factors. And where did they actually come from?
Well, I'd like to take credit for identifying them, but I certainly wouldn't. They're based on research carried out by the Center for Applied Research in Mental Health and Addictions and the Faculty of Health Sciences at Simon Fraser University in British Columbia.
So, Chuck, we see those 13 factors displayed on our screens, and perhaps you can walk us through some of them in a little bit more detail.
Certainly. So I'll concentrate on identifying 3 or 4 of the factors for the purposes of today's webinar, but also note that a full disclosure and description is included in the standard itself for those that have accessed it thus far. So what are the 13 workplace factors? Well, you see them on the screen, and the first one I'll introduce is psychological support. Psychological support refers to a supportive work environment for employees when they are experiencing psychological and mental health concerns. It means that supervisors and coworkers know how to respond appropriately to psychological concerns, and also refers to any interaction between people at work. So that's people sitting beside you, people sitting down the hall, and so forth, and refers to how much trust there is between coworkers and between managers and employees. So let's ask ourselves a couple of questions. Do employees feel supported by the organization? Do they feel that the organization values their work? I think it's important to note it is much about employees' perception and awareness as it is any formal mechanism that might be in place. So looking then at number 3 on your screen, clear leadership and expectation. Why is this important? Well, it's important because it helps employees know what they need to do, and if there are going to be any changes coming up, how those changes will affect them. They also need to see how their contribution to the organization affects the organization as a whole. Number 4, let's pick another. Civility and respect seems an obvious factor to, I'm sure, many on joining us today, but these are not always present in the workplace. And employees need to be respectful and considerate in their interactions with one another, as well as with customers, clients, and the general public. So if I was to pick a 4th, involvement and influence, this refers to ensuring that employees have a say in how they complete their work and also how important decisions are made. As I noted, these 13 workplace factors are very important, present in every workplace, and have very much informed and influenced the content of the National Standard on Psychological Health and Safety.
I'd like now to get a little bit deeper into some of the actual content of the standard. How do you actually put it to use?
Well, that's a great question. The standard is a framework or tool that organizations can use to create and continually improve, and I want to bold, continually improve, used to create continually improved workplaces, striving to make them psychologically healthy and safe for employees. So how does it do this? Well, by outlining the requirements for putting into place a documented and systematic approach in the form of a psychological health and safety management system, or for the purpose of today's webinar, I will refer to the PHNS system from here on. So this system assesses and addresses risks to the psychological safety of employees that can arise from particular ways people are managed or how the work is planned. It would also include a management review of the PHNS system, which means putting in place a process to measure, very important, measure how well the organization is doing in achieving the goals that it's set out for itself within the system environment.
And Chuck, how do organizations establish and actually review a PHS system?
So the steps, the basic steps are laid out clearly in the standard. But how an organization chooses to use them, as I identified a couple of slides ago, is really up to them. The standard is very flexible, as I noted, to industry, size of organization, and where an organization resides in its maturity. The main areas of the standard areas that the standard addresses include commitment, leadership, and participation, planning, implementation, of course, very important, evaluation and corrective action, and finally, management review. So there are other additional resources and a series of annexes connected to the standard which offer a whole host of additional help, but they're key. So let's take a look at them one by one from what you see. So starting off with commitment, leadership, and participation. It's important and really the foundation of the PH&S system. It's important for an organization's leadership to be engaged in the standard from the beginning, or, again, being flexible after some of the data collection referred to a few minutes ago has been initiated, if that are the steps that, the order of the steps rather, that have been chosen for a particular organization. So senior leaders have to believe in it in order to gain participation and engagement from their employees. I think it's practice what you preach and other analogies. They are also the people who can set it in motion.
And what kinds of things do leaders have to do, Chuck, in order to help encourage the uptake of the standard, since at the end of the day that's what's required for change?
Well, leadership, or you can refer to management, really have to ensure that any roles and responsibilities related to this system, this PH&S system, are well defined with clarity, and the people throughout the organization are well informed of them. Again, being fully participatory, workers or employees, I believe, need to have the opportunity to participate in all areas related to development, implementation, and, again, the continual improvement and evaluation of the system. Their participation is essential in order to have their buy-in, and I think it's a key factor when talking about psychological health. Further, employee representatives, or labor, are essential to also understanding the psychological needs of the workplace and participating in the areas I just spoke of. So any policy and process development should involve them at every stage and as a collaborative effort, similar to the creation and development of the standard. And additionally, the standard states that organizations need to establish and sustain processes that ensure confidentiality and privacy rights. Again, we may agree that that is a basic need, but also important to highlight that this is a right and also essential to building trust. So let's look at planning. The next part in making sure careful planning takes place, as this will help the organization identify objectives that are appropriate, the setting of targets and appropriate timelines, and I say realistic timelines as well, and plan on how to meet these, to keep the plan realistic. Planning helps an organization identify and also prioritize any psychological hazards or risks in the workplace, as well as any legal requirement that might exist. So it's important to take into account the diverse needs of the organization's workforce so that these needs are addressed. Because using standards is part of a quality improvement process, it is important to establish processes for dealing with critical events and periodic reviews to see how well you as an organization are doing. So how is this done? Well, through collecting data, such as through employee surveys and other instruments that are identified in the annexes of the standard, and making sure that you are monitoring your progress as you proceed through this journey, and also measuring success. So let's look at diversity moving down our list. You see on the slide, diversity, we mean it's important to take into account the needs of your organization, the diverse needs of your organization's employees, and not all workers have the same needs as we know. So once you have the information you need from your review, you're then well positioned to set objectives and targets for the PH&S system based on what you have learned in the processes that you have gone through. So finally, for this section, an organization should be designing, putting in place, and maintaining a system to manage any change that will affect the psychological health and safety in the organization. For example, any significant changes in how work is done, personnel changes, products, services that may be either introduced or removed. These factors can deeply affect the system, and so need to be well planned. And the standard also highlights important aspects of managing change, is ensuring that there is effective communication with staff. That may include information sessions, training events, lunch and learns. Again, whatever works in your organization, whatever you have learned, is effective communication to support the process. And this will ensure that employees remain engaged, and of course that is key at all stages.
Okay,
wow,
excellent,
that was a long slide.
It sure was, and because of, I'm just cognizant of the time, and because of that, we may have to go through the next one a little bit more quickly. We're getting now into implementation and what organizations need to include in order to implement their PHS system. Right.
So I will go through these a little faster. So there's a long list on the slide, and looking at if I was to pick one, looking at preventive and protective measures, these need to be put in place to address the risk or hazard that were identified by the organization. An example of this might be permitting people to use personal protective equipment related to psychological safety, such as a privacy barrier or something of that nature. Also, the organization should put in place processes that will ensure sustained implementation, and that means including making sure that senior leaders and leaders at every level throughout the organization sponsor the process. We can proceed, Najma, if you wish.
Okay. One of the important aspects of this, too, Chuck, are actually two aspects, those of evaluation and corrective action. So how can businesses and organizations carry out those things effectively?
So an organization needs to make sure that they have a governance plan for implementing the standard. This includes outlining clear responsibility and accountability for those involved. Another important area is establishing and sustaining processes to determine expectations and minimal requirements of workers, particularly leaders, to prevent psychological harm, promote psychological health of workers, and address problems related to psychological health and safety. So the standard states there's a process for assessing and addressing the competence in this area of people in leadership positions, and orientation and training as well as coaching and other supports should also be provided to staff and leaders. The next clause talks about critical event preparedness, and then we move into reporting and investigations. I'll focus more on that. Organizations can put into place procedures for reporting and investigating psychological injury, illness, acute traumatic events, chronic stressors, and so on. Those carry out any investigations. Those carrying out any investigations around psychological injury, for example, as a result of bullying, need to be experienced in this area, and not only have impartial but perceived to be impartial by all parties. And finally, for this section, organizations also need to should inform as a best practice any external parties that they work with, such as suppliers and contractors, or of the policies and expectations related to the psychological health and safety of their employees.
Okay, great. And Chuck, I touched upon it earlier, but let's come back to maybe the evaluation and corrective action and how businesses and organizations can carry out those things effectively?
Certainly. It's important for a business or other organization to be able to measure and measure its efforts in putting a system in place. Is the system effective? Are the policy objectives being met and realistic? How well are we promoting psychological health and safety in our workplace? And will you be surveying the staff? Will you be looking at statistics related to disability, as noted earlier in Louisa's comments, and so on? Think about what you want to measure while designing your implementation plan, I think, is a statement you want to keep front and center. Internal audits are very useful in determining how well an organization is doing in terms of implementation and maintaining its psychological health and safety system. So this is where you have one or more people who are trained and competent and also part of the organization take a close look at each clause of the standard and determine whether your organization has it in place or not. One thing we've found is a number of organizations that have looked at earlier drafts of the standard in their assessments have certainly already taken a couple of steps. Annex E, for those that have a copy of the standard on page 39, provides a sample audit tool. And I think many organizations could use this tool as a, let's call it a self-assessment to see what they're doing already, identification of any gaps, and keep in mind that they can focus on one particular area only if they want as a starting point. And finally, for this slide, preventive and corrective action means organizations take the information they've learned from the internal audit and make change to improve their psychological health system. So next slide, management review. So finally, there needs to be a scheduled management review process put in place so that an organization is engaging in continual improvement of their system. Remember earlier I said setting objectives and targets and establishing timelines are important. Well, the review process includes addressing the degree to which the objectives and targets are being met. And when we talk about the outcome of the review process, that includes opportunities for improvement and corrective action, review, updating organizational policies and procedures related to the system, reviewing and updating the objectives, targets, and action plans, and, of course, making sure that staff know the outcome of the review and the action plans through a well-executed communication plan.
Thank you, Chuck. And now, in the interest of time, we do want to talk a little bit about the annexes. We won't go into great detail on those, but we do need listeners to note that the annexes have a great deal of background information that's very useful. There are many, many resources that you can access there, and also key to the annexes are some sample models and different scenarios that you can look to for examples in terms of how to implement. So, Chuck, why don't we talk a little bit about how people can actually access the standard and the annexes?
So the standard, you'll see now the information on the slide. Now you'll see CSA's website and B&Q's website. The standard is available as, I feel like I should ask for a drum roll, but the standard is available as a free download on CSA's website as well as B&Q's website. You'll see on the screen. People can also access the website through the links from the Mental Health Commission's website. We encourage you to do that, and the links are easily visible on the front page. I will note that this requires a very painless and brief registration.
So, Chuck, if you're an organization that really is very interested, you want to get started, what should you do right away?
Well, I think right away I can sum it up into 3 or 4 points, one being certainly access the standard and read the standard. Share the standard within your organization. Find an opportunity to engage leadership and champion the standard yourself and or with your peers. Another possible step, as I noted earlier, could be the development of a policy statement as the first step. And, of course, there are a whole host of tools that were just mentioned that could be useful to organizations, such as the Action Guide for Employers and the Mental Health Commission's Mental Health First Aid Program.
And, Chuck, why don't we touch briefly on those tools that you just mentioned?
Thank you. So the Action Guide was initiated by the Mental Health Commission of Canada Workforce Advisory Committee and developed by a research group that I identified earlier in my remarks. And it's intended for employers to take action. It's one thing to increase awareness or the importance of psychological health and safety, but something else to identify effective and feasible action. This is a guideline to assist organizations and is also referred to in the annexes of the standard.
And a little bit more maybe too, Chuck, about mental health first aid, which Louise also mentioned earlier in the webinar.
Certainly. So mental health first aid is evidence-based, 2-day course that trains people to become literate about the basics of mental illness and mental health problems. Participants learn how to recognize, not diagnose, but recognize when a colleague might need assistance, how to provide initial help in the event of a mental health crisis, and guide a colleague in need towards appropriate professional help. Mental Health First Aid Canada joined the Commission in early 2010, and based on recent figures, 65,000 people from across Canada have been trained so far. You'll see on the bottom of the slide the website to access additional information.
Thank you very much, Chuck, for this excellent overview of the standard. And we do want to allow a few minutes for some questions from the audience. We've been having some come in throughout the presentation. If you do have a question, please send it to us in the chat function at the bottom right-hand corner of the screen, and we'll try to answer as many of them as we can in the time remaining. So the first question I have actually would be directed towards yourself, Louise. And one listener would like to know if workplaces have taken up some of these initiatives, some of the things that we've been talking about this morning. This particular listener finds that in New Zealand, companies accept this issue, the issue of the importance of mental health in the workplace, but then they struggle to take actual steps to deal with it.
Yes, well, I don't think that is dissimilar to what people are finding in Canada, actually. I think that Chuck's later remarks with regard to the annexes is extremely important. The standard itself is only about 15 pages long, and it's really the annexes that give people really good ideas and ways in which to action the standard itself. I've also heard Chuck use the term that the standard is about using tools and not rules, and so that's very important. There are organizations here that have adopted the standard already, not the least of which is the Mental Health Commission of Canada, and so we have actually done a few things that I think are really quite meaningful and will have an impact on the psychological safety of the staff within the Commission. So I think referring people to the annexes is extremely important. People want to do what is right and they really want to help. They simply oftentimes don't know how, and this is a good way for them to be able to learn that.
Thank you, Louise. Chuck, I think this is a question that could be answered by yourself. This listener would like to know if you have any sense as to whether any Canadian jurisdictions plan to incorporate the standard into their occupational health and safety laws and make compliance mandatory, although we talked before about how at this time it is not a mandatory standard. But what do you see down the line?
No, I don't think that's an excellent question, and I don't think that that we will see mandatory integration with the standard into occupational health and safety laws. It is intended as a continual improvement process for organizations that recognize their organization and their people may be experiencing issues, and they want to prevent and promote psychological health and safety. And the consensus of the technical committee was to develop the standard on a volunteer basis that would elicit more traction in the time to come.
And Chuck, maybe another question for you. Are there some sample policy statements and things like that within the standard this particular listener would like to know?
Yes, that as well is a great question. In the employer action guide and in the annexes to the standard, there are a whole host of resources that include draft policy statements, and also a number of resources that are available at no cost in the public domain that I would encourage. As Louise noted, the standard itself is only 15 or 16 pages, and the annexes represent a considerable body of resources available to employers of all size.
Okay, thanks, Chuck. Another question for you. Is there an actual checklist of specific requirements for the psychosocial well-being of people in the workplace? We talked about some of those psychosocial factors, but is there an actual checklist of specific requirements?
Can you repeat that question, Nujma?
Is there a specific checklist of requirements in order to have psychosocial well-being in the workplace? Can you find that within the standard or elsewhere?
Well, through one of the tools highlighted in the standard that was developed again by a group with Simon Fraser University in BC, looks at the 13 workplace factors that are present in any workplace and identifies the level of risk through a variety of quick initial scans to full survey instruments for employers to assess the level of risk in each of the factors. So I think that is in essence a checklist. As well, in the annexes, the 13 workplace factors are highlighted in a diagram in addition to a full description of the 13 workplace factors individually, and provides links for organizations that are interested in moving forward with additional scan of their workplace.
Okay, that's excellent. Another question has come in from a listener, and Louise, perhaps this is one for you. Is there a link between psychological health and safety and stigma, the issue of stigma that we hear a lot about?
Yes, absolutely. I think that I've often said all roads lead to stigma, and it's a large part of why we need the standard in the first place. As long as people are too ashamed, afraid, or embarrassed to go for help, they're also going to feel the same way about disclosing to employers. I think a very good example of that is situations where people are off of work due to a mental illness or mental health problem, and they never see a card or a bouquet of flowers, whereas if people were off with having surgery or other illnesses, there's all kinds of support going out for the person. So I think this in turn makes it really bad for accommodation to be made, because people simply don't want to talk about it, and it's very hard to arrange for accommodation if we don't know what is needed. And certainly it bodes badly for preventing things like this happening in the first place. So one of the initiatives that the Mental Health Commission of Canada has embarked on is actually evaluating programs that help to reduce stigma in the workplace and learning to see what actually helps to make a difference. So I think it's important for us worldwide to be able to share these good and leading practices because stigma is such a serious issue.
Thank you, Louise. And we have time for one last question, which has come in. And I think maybe Louise and Chuck, each of you have something to say about this particular question. What can we do if an organization is reluctant? So how do we, any organization, encourage a workplace to actually uptake the standard and make use of it? What if there's reluctance? How can we encourage people to actually use it? Maybe Chuck, start with you.
Sure, I'm happy to start with that. A couple of brief comments. I noted in my remarks some organizations that feel that this is on their agenda now. It's being driven by senior leadership. The first step would most likely be the development of a policy statement, and then moving through the implementation of the standard beyond that. For organizations that are experiencing some reluctance, I feel that the most appropriate way is for a team of peers to look at the standard, become familiar with the standard, and also consider the baseline data of their individual organization that may assist them in, I'll say, building a case to present to leaders within the organization to ensure their buy-in. I mean, it's a population health issue, and some will require additional assistance to get them there.
Thank you, Chuck. Any final thoughts from you, Louise?
Well, I would say that if I can't appeal to people on the basis of what is right for human beings, I point to the bottom line. And so if you look at the economic costs of unhealthy workplace, I think that certainly speaks for itself. But at the same time, I'm not sure that anybody really wants a bad workplace. And we know that unhealthy workplaces experience difficulty with recruiting really skilled help and people, and that we don't retain good people when workplaces are unhealthy. So therefore, I would use some of those arguments because they speak volumes in terms of some of the statistics that I had cited earlier on in the presentation.
Okay, thank you. And that is all the time we have for today. So I'd like to thank both Louise Bradley and Chuck Bruce for speaking to us about this important new standard. And thank you to all of the participants who joined us from around the world. And if you had a question that was not answered today, don't worry, you can also still contact us and we will get back to you. The session has been also recorded. We'll be sharing it on our website in the days to come. You can send us comments through Facebook or Twitter, and for more information you can also contact Sapna Mahajan, who is the project manager on this initiative. Her address is on the screen there. So thank you once again for your attention and have a great day.